So, it's my first full day na sa may hospital. Nagpa-admit ko yesterday because when I woke up before lunch, when I poop, my blood sa poop ko and dumadjada mo siya, mga 5 ml and fresh blood siya. And then after sa to, tanaw ko, before eating, I felt faint. Dumadipong ko, nalulum akong panulukan. And then nag-okay man siya. Naka-eat pa man ko. Pero amo na, syempre, like, since I'm undergoing chemo, mga things like that, you can't really ignore. And, like, dapat ipa-check it. So, para makampante man kami, we've decided to go sa my doctors and magpa-admit na lang gid so that I can undergo different tests just to make sure nga clear and wala sa internal bleeding or something like that. Especially since very strong ang mga medications ko. So, just want to be safe. Hopefully, today we'll get the results and hopefully maklear lang ni Doc so that ma-discharge man kami as soon as possible. But just wanted to let you know out there na don't ignore the small things, guys. If may kaka-feel ka mo or something, please pa-check it ka mo. Hindi ka mo makulbaan if ever nga may mga findings or what. Kaya it's better that you find out about it at an early stage kesa nga gabi na ginabatchag nyo before pa ka mo magpa-check. So, early intervention, early detection is always better. So, amo lang na, guys, if ever may kaka-feel ka mo or what, pa-check it dayon. Don't ignore the small things, okay? And take care of your health.
Hi, it's early Tuesday morning, 2:11 a.m. I just wanted to share that I had my fifth chemo session earlier, so Monday, and I'm so happy that I only felt a little bit nauseous, and then it disappeared after a few hours. I was still able to eat really good, and the main side effect that I experienced right after the session is that I just couldn't taste food very well. The taste was not it for me. So yeah. Anyway, I feel like now is the time that I'd like to share my experience during the actual chemotherapy. So,
Rob,
One moment, I'm
Daniel
still
Island
working.
ni Esting
Hi, so sorry I wasn't able to go back because I got busy with work, lots of meetings. Anyway, back to my story. So, yeah, yesterday was my fifth session. My last session is going to be on the first week of September. Thankfully, like I said, I'm not experiencing any drastic side effects aside from the nausea and the loss of taste for the first few days. But I am taking medicines. One of the meds that I'm taking is steroids, so I'm getting the moon face. It's getting circle. Aside from that, so let's go back from the start. When I first started my chemotherapy, first thing that I experienced was the loss of taste. The food that I was eating, I don't know, the taste was off. And then there's this metallic taste at the back of my throat that I was tasting and kind of smelling as well. By nighttime, so I finished my first chemotherapy session at around 11 or 12. And then at around 7 p.m., during dinner time, I was extremely nauseous. Extremely nauseous. I only forced myself to eat because I didn't want to lose weight or something like that. I really wanted to puke, but I stopped myself because I have heard of a lot of patients experiencing nausea and then puking and then experiencing drastic weight loss because they couldn't eat. So I really stopped myself, and thankfully I didn't. And then on the seventh day, when I finished my meds, that's when I started experiencing this hot burning sensation on my right hand, because this was where the IV was being administered. So yeah, it lasted for like 3 days. It's funny because in the first 6 days, like I felt fine aside from the nausea, which subsided like after 3 hours, like at around 10 p.m. I was like feeling better. The next day I was completely like normal. I even like rearranged our pantry. I wanted to do a lot of stuff because I had a lot of energy. So yeah, first 6 days I was fine. And then seventh day, that's when I experienced like the pain, the hot burning sensation on my right hand, and then it lasted for 3 days, and then I was fine again. And then I was mentally preparing myself and physically as well. I tried working out and walking just so that like my body still has like that exercise. And then yeah, and then I was ready for like my second session again. So the gap between my first chemo and like my next session is like 2 weeks. So I do my chemotherapy every 2 weeks. So second session, it was still the same. Third session though was the worst. Still the same. I experienced nausea, but like not that much. The most horrible thing happened. It was because when they pulled out my IV after my chemotherapy session, it was a student nurse, and then when she pulled it out, the IV kind of like bent. So I feel like the medicine leaked on my right hand, but I didn't know at the time. But I was feeling weird because like right after my chemo, I was already feeling the burning sensation, which is weird because I've never experienced this. I experienced it in my first 2 sessions. So yeah, I got nervous, and then like from the first day until like the 10th day, it was horrible. I was experiencing extreme pain, hot burning sensation. Good thing cold compress kind of helped, but I only did cold compress on like the 7th day onwards. I even consulted with like a doctor from Doctor Anywhere, because like my oncologist wasn't available on like the day that I experienced the worst, and I had to take pain medications. So, but it kind of like didn't help because it was just horrible. So yeah, like that was, I was crying during my shift because I was still working. I was even like in the middle of the night, I would just sit up and then just cry because the pain was like intolerable. So yeah. And then thankfully, on just right before I went back to my doctor for my follow-up checkup, the pain has subsided, but I did mention it to my oncologist, and he told me that he'll request one of the more experienced nurses to like administer and pull out the IV for me. So thankfully, on my fourth session, like it was okay. My favorite nurses were the ones who administered and pulled out the IV, so I felt fine right after. So still the same on my fourth session, nausea, and then on the 7th day, a little bit of like discomfort, but no pain anymore. So yeah, and then on my 5th session, now I'm doing fine. I am just so thankful that I'm not experiencing the same things that other people who are undergoing chemotherapy. I am so lucky. I am extremely lucky. I am grateful. But of course, like although I'm not experiencing the same things as them, there are some mental and emotional stuff that you really need to prepare for. One of the things that I feel like I have developed throughout my stays in the hospital and during like the chemotherapy session is just the needles. I'm not afraid of needles, but there's like this trauma that developed because like during my like while I was getting diagnosed, or like just taking the diagnostic test before my diagnosis, I already developed like that fear on my IV, because I was like injected like a couple of times because they couldn't find the right vein. So yeah, like it hurt, and then I was crying because of that. I didn't cry upon hearing my diagnosis, but I did cry because of the IV. So yeah, and then aside from that, of course, like the mental and emotional preparation that you need to do before every chemotherapy session, because it's like basically when you do chemo, you're going to experience symptoms. That's like a week of you knowing that your body is not okay, and then the next week you're doing fine, but that's preparation, or your body needs to be fully recovered in preparation for your next session. So it's like this cycle of like having to go through the same thing over and over again. It's mentally and emotionally exhausting. One moment. So yeah, like I said, it's mentally and emotionally exhausting of having to go through that cycle over and over and over again. And then, of course, like there are some personal stuff that you also are going through, like family matters and all that stuff. And then, of course, like I think one of like the bad things is that I was diagnosed with Hodgkin's lymphoma, right? So Hodgkin's, if you do your research, it has a high survival rate on like the first 5 years, and then of course it's getting like lower after 10 years, 20 years, but it's still higher compared to other people with other types of cancers, right? But of course, like it's just that, when you hear from people that it's the better cancer, or like you're lucky that you only have that, it's kind of like, I don't know, it's kind of invalidating hearing that from people, because it's still cancer. It's a lifetime of monitoring, um, the anxiety before every scan of like, you know not knowing whether or not you're going that there's going to be like a relapse or something like that. It's still cancer, so I don't know. I feel like there's no better cancer. Every cancer patient going through this is going through a lot of things. So yeah, um I know I'm lucky, but at the same time, during my last hospitalization, it just nagsink in lang sa akin na shit, oo, may taas na survival rate for like the first 5 years, but then it's getting lower after 10 years, after 20 years. And by that time, I'm going to be older, and I'm not sure if my body can keep up with that, right? So, like, there's just this fear of knowing that I might not last for as many years as I want to, and be able to spend that with family. So, that's just one of the realizations that, nagsink in sa akin sa last ko na hospitalization. Just when I'm starting to live my life, all of a sudden I got this diagnosis. And then there's still a lot of things that I want to do. And then now that I'm out of the hospital, my lola is currently admitted. And there's a possibility that she also has cancer, but it's base sa colon niya. I'm not sure yet, wala pa sa final diagnosis, but she's old. And wala pa ako kabawi sa iya. It's just ironic na for like every person na may cancer also has to deal with a lot of like different things, and not just the diagnosis itself. There are a lot of aspects in our lives that we need to deal with. So right now,
I feel like if this is my capacity, I'm like right here. So every small thing that triggers me makes it harder. I feel like I have been living my life in on hard mode since the beginning of time, and then now it just got harder. It's just a matter of like being mentally strong, and I am mentally strong, emotionally strong, but it's just there are some very bad days where I have to deal with a lot of stuff, and it is overwhelming, and it can be exhausting. To be honest, sometimes I would think that it would be better if I just died, because that way I don't have to deal with it, but I know it's not going to be better because there are still a lot of people in my life that I want to spend time with. I still want to live my life and all of that. So that's why when you see my posts, I always try to encourage people to like just to continue fighting. Even my friends, when we talk, I'll always tell them to just keep pushing forward because there's so much more to life than this. I don't know. But yeah, anyway, I created this vlog because, like I said, I wanted to share my story, my journey. I wanted to record this and go back to this once I've beaten cancer and say fuck you to cancer. And I also want to share that I just got another haircut. It's because I was starting to look so sickly with my previous haircut. It was already short, but my hair continues to like fall off because of like the side effects of chemo. So, ginunahan ko na naman siya. Here's my surprise. I'm officially bald. O, diba? Tubagay, mansa ko na. In fairness. Yeah, so I just wanted to share my new haircut. What do you think? Do I look good? I'm starting to like, I want to reinvent myself. Well, reinvent myself. And like just create a new persona, charot. Pero I'm already like adding to cart some bonnets and like outfits sa may Shopee. Gotta reinvent myself. But yeah, officially bald. That's it. So that's my story. That's what I'm going through right now. Basta guys, fight lang. Wow, this is the first time that I'm going to be sharing a video of me crying sa public. But I guess like, I don't know, I feel like there's beauty in vulnerability, and that even the strongest people go through things. But this is something that I can beat. I know I can beat this. I'm just going to have to keep on fighting. Not just for myself, but for my family and friends as well. So, yeah, that's it.